Arteries of the lower extremity. First question we should discuss concerns these two old terms. We know these terms from first course, lacuna vasorum et lacuna musculorum. What is it? Here it is the picture from Atlas of Sinelnikov. We can see hip bone and soft tissues. I use now green color to demonstrate the distal part of aponeurosis musculus obliquus abdominis externus. Aponeurosis musculi obliquus abdominis externus. This aponeurosis in the most inferior part used as a border between abdomen and the leg. Now I demonstrate you with a red line this structure. Ligamentum inguinale. Ligamentum inguinale is part of this aponeurosis of musculus obliquus abdominis externus, those part which is between two bones, two portion of bones, spina iliaca anterior superior here and tuberculum pubicum here. So all this space between hip bone and between inguinal ligament could be divided into two lacunas, lacuna vasorum and lacuna musculorum. Why they have such name? Because there are special structures which we can find there. What structure divides the space into two lacunas? I use now new red line which divides the common space into two parts, and I'd like to remember that it is arcus iliae pectineus. This is arcus iliae pectineus. It's fascial sheet which inserts to arcus ilia pubicus here, or eminentia ilia pubica on the bone, and arcus ilia pubicus divides this space into two parts. And now let me colorize the lateral part which is lacuna musculorum. Lacuna musculorum, this name because through it passes musculus iliopsoas from the abdomen to the thigh. So lacuna musculorum is laterally located space under the inguinal ligament. Together with musculus iliopsoas, we can find the structures number 13. What is it? It's nervus femoralis. And let me ask you, nervus femoralis is located in lacuna musculorum from lateral side or from medial? I hope you answer from medial side, so it's more close to the midline. It means medial position. And also we can find here another large space which we can call as lacuna vasorum. Again, I'd like remember that musculus iliopsoas is here, nervus femoralis is here, number 13, and now I colorize lacuna vasorum with yellow color. Lacuna vasorum calls this way because there are some vessels here. What vessels? Now, when we are watching from anterior view, we can say that they are arteria femoralis and vena femoralis. But if we tried to watch the same structures from posterior view, from the back, we can say that they are arteria et vena iliaca externa. It means that between arteria iliaca externa and arteria femoralis there is border which is ligamentum inguinale. More cranially, according ligamentum inguinale, we call this vessel as arteria iliaca externa, and the more caudally to it, we call it as arteria femoralis. Some important question which we need to discuss. When we compare these two vessels, arteria and vein, which of them is medially located? Sure, you can see that medially located vena femoralis. And also, number 8 demonstrates us lymph node. Sometimes we can read in the textbook that it's lymph node of Pirogova. It was described by famous Russian surgeon and anatomist Pirogov. And very important that this remnant space medially to vein is dangerous for forming femoral hernias. Femoral hernias in conditions of weakness of the muscles, of widening of all these spaces, are results of increasing intra-abdominal pressure. In what situations intra-abdominal pressure increases? When we make any very hard work, when we try to carry very hard things. And intra-abdominal pressure in such situation can result forming femoral hernia in this place. So I'd like we remember these details from first course before discussing the arteries themselves. Now let us try to remember the classification of branches of femoral artery. So there are two large groups, superficial branches and deep branches. As superficial branches, we can call arteria circumflexa ili superficialis and arteria epigastrica superficialis. And third vessel is arteria pudenda externa. Arteria pudenda externa, you can see it's written in plural. Arteriae pudende externe. It means that usually we can find or two such vessels, or arteria pudenda divides into two daughters branches. And also we can find deep branches. First of all, arteria profunda femoris. Arteria profunda femoris, which also branch into arteria circumflexa femoris lateralis, arteria circumflexa femoris medialis, and three perforans arteries, arteria perforans prima, secunda, and tertia. And also two deep branches, we concern arteria genus descendens. Arteria genus descendens, it is branch from arteria femoralis itself, not from profunda femoris, but from arteria femoralis itself. So, that's all. How much vessels we can numerate here? Practically 7 and 3, 10 vessels. Now, let us look to this picture. Inguinal ligament and arteria iliaca externa becomes arteria femoralis. And here, quite high, close to inguinal ligament, we can divide it into arteria femoralis profunda and arteria femoralis itself. Sometimes in several books and textbooks they call this arteria femoralis as arteria femoralis superficialis. Arteria femoralis superficialis. But in our textbooks we use term arteria femoralis. That's all. So it's written here, arteria femoralis. And now let us compare it with the scheme on the right part of our screen. What is the difference? That in left picture we use some remnants of muscles for understanding the course of artery. And here, in the distal part of the thigh, we can find so named canalis adductorius or Hunter's canal, through which arteria femoralis passes to the popliteal fossa, and that's why another name of this canal is femoropopliteal canal. And also through medial wall of this canal a small vessel comes downward. It's arteria descendens genus, arteria descendens genus. And in right part of our picture this arteria descendens genus is here. And now let us try to find all these branches ourselves. So I propose you another picture. Here it is, without any designations. Let us make together these designations. First of all, this abbreviation AF, what does it mean? Arteria femoralis, sure. In this small region, about 3 or 2 centimeters, it's branching 3 vessels. Exactly. This cis, what does it mean? Arteria circumflexa ili superficialis. It comes to spina iliaca anterior superior and comes parallelly to the arteria circumflexa ili profunda. So they similar to each other, but border between them is ligamentum inguinale. Then, in medial direction, another artery, which abbreviated as ES, what does it mean? Arteria epigastrica superficialis. Arteria epigastrica superficialis. And then, third branch is arteria pudenda externa superficialis. Arteria pudenda externa superficialis. We already have said that usually there are 2 such kind of vessels. That's why another vessel, arteria pudenda externa profunda. So they can be added to each other and looks like single vessel, which later becomes divided, and like now 2 different vessels. So here we have drawn vessels of superficial group, arteria femoralis. And now let's discuss vessels of deep group. First of all, this is arteria profunda femoris, PF, arteria profunda femoris. For see it in good condition, we need to cut off the femoral artery, and that's why femoral artery here is absent after this level. Arteria profunda femoris gives next branches. Arteria circumflexa femoris medialis and arteria circumflexa femoris lateralis. Here they are. Sure, you can ask me why arteria circumflexa femoris medialis calls this way circumflexa femoris medialis, but we have designated it in the same region as circumflexa femoris lateralis. Name of this artery depends from the point of origination. It is first of all being prepared medially and then make turn to the lateral side, and that's why they goes later parallelly circumflexa femoris lateralis and medialis together. But origination, you can see, practically is in the same point, but medial artery goes medially and lateral artery goes laterally. Sure. And now we can compare the role of these arteries. They are similar to arteries of axillar region, arteria circumflexa humeri, anterior and posterior. So they turn out the column, the neck of the femur, and make a vascular ring around the column and upper portion of the diaphysis of the femur. And another very interesting vessel, this one, what is it? I'll also use this large scheme for demonstrating it. What is it? It's ramus descendens of what? Of arteria circumflexa femoris lateralis. You can see that it's quite long, practically from upper part of the thigh it reaches the ankle, and it could be 30 or in very tall people 50 centimeters, quite long. So this is additional branch, ramus descendens, arteria circumflexa femoris lateralis. Here it is again. And now ramus ascendens, AA, here it is, AA, ramus ascendens. Ramus ascendens comes to spinaliac anterior superior and also make anastomosis with arteria circumflexa ilii superficialis and profundus. So these three vessels meet in the same point and make large anastomosis. And now P1, P2, P3, what they are? Arterie perforantes. Perforans prima, secunda, tertia, and most distal part of arteria femoralis profunda is designated as DP, distal part of arteria profunda femoris. So arteria profunda femoris practically here is finished. So it terminates through distal part of arteria profunda femoris. Now let's discuss the biological role of these four vessels: perforans prima, secunda, tertia, and distal part of profunda femoris. Why we need to have these arteries in our organism? It's because of biological law. All arteries, all large arteries and veins and nerves, they passing on the anterior or flexial surface of large joints. So it means that hip joints has a flexion surface as anterior surface. When we flex our hip joint, the thigh moves to abdomen. And when we extend hip joint, thigh moves to the buttocks. And that's why arteria femoralis and arteria iliaca externa, they are located on anterior surface, on surface of flexion. But for the ankle joint, the flexion surface is back surface. And that's why the popliteal artery is located on the back surface. And how we shall nourish very large muscles on the posterior surface of the thigh. So for these purposes, for nourishment of the posterior group of muscles of the thigh serves these 4 vessels, 3 perforans and distal part of arteria profunda femoris. Okay, and now let's compare this picture with another. It's picture from Atlas of Anatomy, author Sinelnikov, and we can distinguish inguinal ligament, so arteria iliaca externa and arteria femoralis. Femoralis gives branch arteria profunda femoris, gives circumflexa femoris lateralis, here it is, and superficial branches which we already know. Then another example, all superficial muscles were removed. You can see the place of cutting, and that's why we can demonstrate both femoral artery and deep femoral artery. This is arteria circumflexa femoris lateralis, and this is origination of circumflexa femoris medialis, and then it turns to lateral side and they make a vascular ring around the thigh. And now let us try to distinguish here these hidden arteries, but very important, which called arteria perforantes. Arteria perforantes. I use these red arrows to demonstrate them. So you can say that they goes parallelly to each other. They goes from anterior to posterior direction, and the distance between these 3 vessels are similar. And also I'd like to demonstrate here arteria descendens genus. Here it's written as descendens geniculi. Practically it's the same, and term geniculum is very small genus. That's why if, for example, person is quite large, it would be not correct term, but practically it's synonym, arteria descendens genus or descendens geniculi. And I'd like to demonstrate that this small vessel, arteria descendens gyniculi, it is vessel which appears in this point. It penetrates this fascia, which calls lamina vasto-adductoria, and it penetrates this lamina together with nervus saphenous. So we can say that arteria genus descendens passes through anterior opening of canalis adductorius accompanied by nervus saphenous. And it is good possibility to remember again this canal, canalis adductorius. I'd like remember its 4 names. First name, canalis adductorius. Second name, canalis vasto adductorius, because this is musculus vastus medialis, this is musculus adductor magnus, and canal is formed between these muscles. So second name, canalis vasto adductorius. Third name is author's name, Hunter's canal, and fourth name is canalis femoral-poplitus. Why this name? Femoral-poplitus. You can see here arteria femoralis, but where is popliteal artery? It isn't seen here. Why? Because we need to turn the specimen and watch the popliteal artery from the back side. That's why femoral poplitus. It means that through this canal, arteria femoralis being passing changes its name. So arteria femoralis becomes arteria popltea. And now let's use another picture. You can recognize that its posterior surface, that anterior muscle, no, that more superficial muscles were cutted and opening in different directions, and in the most deep region of posterior surface we can find several vessels. What they are? First of all, we can see here several perforans arteries, arteriae perforantes. First, second, and third. And now, one else vessel, ramus profundus, arteriae circumflexe femoris medialis. Ramus profundus, arteriae circumflexe femoris medialis. Let's try to recognize the most important muscles. Sure, you remember this muscle which called piriform muscle, musculus piriformis, and superiorly to it we can find musculus gluteus medius. More deep we can find gluteus minimus, and here these are musculus obturatorius internus and small gemelli muscles, musculi gemelli, and this muscle is very good seen in our cadaveric specimen. So this is musculus quadratus femoris, musculus quadratus femoris. And then all these structures are parts of musculus adductor magnus. It's adductor magnus. And for understanding where these perforans arteries are located, let's compare them. So, arteria circumflexa femoris medialis, its ramus profundus, arise here between quadratus femoris and the most superior head of musculus adductor magnus. So in this gap we can find ramus profundus, arteria circumflexa femoris medialis. Then arteriae perforantes, first of them penetrates the space between superior head and another portions, and second and third penetrates the main part of adductor magnus. So during the surgical operation or during the preparation, we can recognize these vessels due to features of their locating. So this is the main features of these vessels. And again, to distinguish them, let's look at this picture. What can we see? Hip joint, femur, hip bone, foramen obturatorium, and here it is arteria femoralis. Arteria femoralis. And more distally, it is cutted from this point to this point. Why we need to cut the artery? For seeing better the deep femoral artery. Here it is. What is this? Arteria profunda femoris. Arteria profunda femoris. Here it is. Arteria profunda femoris. I use this red square for designating arteria profunda femoris. Here it is. Then, from it, we can demonstrate arteria perforans prima, arteria perforans secunda, and arteria perforans tertia. So three vessels goes parallelly to each other, and we can see here only one muscle. So all three vessels penetrates one muscle. What is it? Adductor magnus. So adductor magnus is quite large muscle, and here you can find several heads of it and place of insertion to the bone. So all this is the same musculus adductor magnus. And now this is a scheme of the same place from lateral view. Let's try to understand. This is arteria femoralis. It passes this way and branching to the arteria profunda femoris. Here it is, arteria profunda femoris. And there is very interesting interactions between arteria profunda femoris, perforantes, and musculus of yellow color, adductor longus. Then in middle layer of green color, adductor brevis, and more deep located of blue color, adductor magnus. Why we need such kind of scheme? First of all, to understand that first perforans goes superiorly to adductor brevis, and second perforans goes inferiorly to adductor brevis, and third perforans goes most distally and on the same distance penetrates musculus adductor magnus. So all three vessels should be found there in the posterior view, in posterior surface, and they again branch into the small arteries, nourishing posterior muscles of the thigh. And one more picture. It is posterior view of the same vessels, and I'd like to point out that all muscles was removed and only adductor magnus we can see here. All these muscles belongs to adductor magnus, and most superior part of it, which I colorize now with red color, is the border for first perforans. Perforans prima penetrates adductor magnus in this gap between triangle shaped most superior part of adductor magnus and the another portion of it. Okay. I think popliteal artery we shall discuss next week. And now, summarizing this material, I'd like to say arteria femoralis serves for two purposes: for vascularization of anterior surface, it's due femoralis itself, and to vascularization posterior surface of thigh. This role plays arteria profunda femoris with its three perforans arteries and with arteria circumflexa femoris lateralis and medialis. Thank you. You are free.